Hey, I have two questions. One is about epigenetics. Have you come across any studies of, for instance, those pigs that had the lung transplants? Have there been any results or any analysis into their offspring? And have any of your patients noticed any epigenetic changes, if it's been long enough?
Yeah, I mean, the long enough part would probably be the biggest thing. I mean, there's some interesting stuff where the whole Ambrosia project where you're taking young blood and putting it into an older person. I think we're probably quite a far away to actually seeing the epigenetics of thing. And then it also gets into that territory of like, let's say you're a younger couple and then having a child. Do you want to then give yourself stem cells and then see what happens? I mean, these are 10, 20 years type of things, right? To see it its full place out. But I do like the idea of just, again, enhancing the body's own natural recovery capacity. I think that's probably the biggest focus that I try to address.
And as you're opening up your two offices, what sort of psychosocial screening are you doing for patients, especially as you're moving more into well care?
Yeah, I mean, I think that's a really interesting topic. I mean, one of the concepts that we have is I wouldn't say it's just mindfulness, but once you're starting to address sleep, that's about stress reduction. I mean, some of that's just intake stuff. Obviously my background's not in psychology or psychiatry, but I think there are elements to incorporate in that. And so also there's some things on mindset and peak performance. So I think it's a hybrid. I think we try to do as much as we can in terms of focus and scope. But, obviously if there's something that comes outside the scope, the idea is to find a provider or joint venture with somebody who's really good at that,